Good afternoon. A groundbreaking medical technique kept this woman alive with no lungs until she received a transplant.
Believed to be a medical first, the procedure was performed at Toronto General Hospital. Surgeons made the call as Melissa Benoit was only hours away from death. CTV's Janice Golding joins us live now from Toronto General. Janice, Benoit says the medical team brought her back from the dead.
Melissa Benoit has suffered from cystic fibrosis all her life, and for the past 3 years, she's got an increasing number of chest infections. And then last April, she caught the flu and began coughing so hard she fractured her ribs. Her lungs started filling with pus, blood, and mucus. Essentially, she was drowning and unable to breathe, which is why doctors decided to take a risk, which you'll see clearly paid off.
Everyone gets a puddle, of course.
As Melissa Benoit plays with 2-year-old Olivia, she looks like any other mother, but Benoit is one of a kind.
She was dying of septic shock, and there was nothing that we could do to save her except take out the source of sepsis. That meant taking out both her lungs, and that had never been done before.
So doctors removed her lungs, keeping Benoit alive on machines for 6 days before she got double lung transplant. It's the first time in the world this has ever been done.
Without them coming up with this procedure, I wouldn't be sitting here today. I wouldn't be reading stories to my daughter. I wouldn't be with my family.
These are the machines that kept Melissa alive for 6 days. The VA ECMO machine supported her heart and kept her blood pressure stable. And the Nova lung physically replaced her lungs, allowing doctors to remove them from her body. Benoit, who has cystic fibrosis, had H1N1 and was so ill she was completely unconscious when her family gave doctors the go-ahead.
We had the option of Melissa dying there in the room or her dying on the operating table because the procedure was so risky. And we all spoke at the same time. It didn't take very long for us to insist that Melissa would want to go right to the end.
Benoit spent 6 months in the ICU, but she's home now.
For the first time in my life, I can actually say that I feel like I'm living. Despite the little consequences that happen from surgery, from the procedure, from being so sick, in the grand scheme of things, it just doesn't matter. I get to be home, and it's the best feeling in the world.
A mother who's been given a second chance and is savoring every moment. Benoit's procedure has been attempted before elsewhere in the world, but has never been successful before. Benoit says she's very grateful to her donor and her donor's family and wants to remind everyone what a difference organ donation can make. Reporting live, I'm Janice Golding. Now back to Ken.
Thank you, Janice.